Hello and a very good day to Professor Madia Chin Kim Fung. My name is Natalie Michelle Chong Zeme, and today my groupmates and I will be presenting based on the topic we have chosen, which is sex education in Malaysia. There are many challenges that occur when implementing sex education in schools and the public. However, there are programs related to sex education that are available for students and the public in Malaysia. But first, what is sex education? Planned Parenthood explains that sex education is a high-quality teaching and learning about a broad variety of topics related to sex and sexuality, exploring values and beliefs about those topics and gaining the skills that are needed to navigate relationship and manage one's sexual health. To begin with, I would like to discuss one of the challenges of implementing sex education in Malaysia. There are many misconceptions about sexual education and the use of contraceptives by the public. The current understanding of the uses of contraception by the general public is not good because many feared that the pill could contribute to infertility and abortion. This is completely false as there is no evidence from any studies to support this. Side effects like weight gain and mood swings may manifest in some, but potential infertility is not one of those side effects. The rampant cultural stigma and inclination towards a negative or shaming attitude and blatant misinformation with anything sex-related in Malaysia have prevented the implementation of an adequate sexual health education program in schools. According to a 2015 survey backed by the Health Ministry, 35% of the Malaysian female youths believe that having sex for the first time does not lead to a pregnancy, which is untrue if they do not use any protection. Besides that, conservative Islamic groups in this country disagree with teaching sexuality education in schools. They believe that the subject may do more harm than good to the younger generation, and that Islamic teaching itself is enough to provide sexuality education. The second challenge of implementing sex education is the curriculums that are being recommended to implement sex education in schools are disapproved by some individuals. This dissatisfaction with the proposed curriculum for the religious religions are one of the factors on why there has been a major pushback against the introduction of sexual education in schools. A politician from Kelantan was reported in The Star, an English language newspaper in Malaysia, saying that teaching sex education will be encouraging children to learn about sex among themselves, which may result in negative incidences like unwanted pregnancies and baby dumping. Furthermore, a few believe that the syllabus is still not complete as it lacks a comprehensive explanation on sexual intercourse. Thus, it requires further review. The chairman of the Parent Action Group for Education Malaysia stated that there was a lack of consensus on the definition of sex education. That is all from me. Let's move on to the next presenter. Thank you.
Assalamualaikum and a very good day to Prof. Madiah Dr. Chin Kim Fu and my fellow classmates. My name is FARAH BINTI JOHARI and I would like to continue present the challenges to implement sex education, where the challenges is parents are not open-minded with introducing sex education to their children. According to the Colour 2018, some of the Asian parents do not openly discuss about sex to their children due to cultural taboos. Moreover, for some reasons, there are parents with bad past are not open to the sex topic. This can be shown. According to the Colour 2018, there is a 17-year-old unwed mother, which known as Mariam, that hadn't had many conversations about sex since she knew she was pregnant. Parents with open-minded is needed, where Journal of Adolescent Health 2010 had stated that a healthy and open relationship between parents and their children will help their children to make a better decision regarding their sexual activities. Not only that, according to the Star Online 2016, parents are the best sex educator at home, which is the easiest ways to educate the children about sex education during the young age. This shows that an open-minded parents is needed to make sure the sex education can be implemented. The next challenges in implementing sex education is sex education may be a sensitive issue to be discussed. According to Razali 2017, sexuality education has been one of the most controversial issues to be discussed in Malaysia. Furthermore, to strengthen the point, Jasmine 2020 had stated that the discomfort of parents and teachers in discussing the topic related to sex makes the sex education difficult to be implemented. Other than that, according to Razali 2017, some of the people think that any matters that related to sex or sexuality is a taboo that should be discussed only in a private sphere. In the meantime, Color 2018 had stated that the term of sex education should be changed to a proper term since people might think that sex education is about educating children on how to have sex. By changing the term, people will be more open-minded to discuss the topic instead of thinking it is a sensitive issue. That's all from me. I will pass to the next presenter. Thank you.
Thank you to my friend who presented their point just now. My name is FAIZAH HEIFEIHUMAIRA. I will be presenting about the programs that is available for students and public. Comprehensive Sexuality Education (CSE) is one of program that is available for students. CSE helps young people to develop positive values about relationship, particularly issues regarding family life, culture, and gender role, which are important as learning how to avoid unintended pregnancy and infection is very crucial. The foundation of CSE is a firm grounding in human rights, which include the rights of children, the empowerment of young people, and a reflection of the broad concept of sexuality as a natural element of human development. CSE does not increase sexual activity and sexual risk-taking behavior, as it is effective in preventing, reducing early unintended pregnancy, and reducing the number of sexually transmitted disease, STD, and HIV infection rates. CSE also gives Malaysia an opportunity to take a leadership role, mobilize political commitment, promote meaningful youth engagement, and strengthen existing sexuality education program. The other existing program available for students and public which is related to sex education in Malaysia is Pendidikan Kesihatan Reproductive and Social Peers. Peers strive to establish positive ideas on reproductive and social health, give necessary sexual health knowledge, and assist students in developing skills to make responsible decisions related to sexuality and social life. Peers is incorporated in subjects such as physical education, moral education, science education, and Islamic studies, which are covered from year 1 to Form 5 syllabus. The content of peers also includes alcohol and substance misuse, interpersonal relationship skills, stress, conflict and mental health management, family roles and relationship, safety issue and management, and illness prevention. In 2011, a study compared peers against the Comprehensive Sexuality Education Guidelines syllabus by University Kebangsaan Malaysia and found that 90% of respondents agree that sex education has not been taught in Malaysian schools and the informal information given by most of teachers are vague. That's all from me. Thank you.
Very good day to Professor Madia Chin Kim Fui. I am IZZATUL SHAHIRAH binti Malik, and I'll be presenting the next main points. The other current sex education program that is available to students and public is through the religious and moral education. In Malaysia, most Muslims and non-Muslim students are taught separately on Islamic and moral education subject. As part of curriculum, Islamic education at primary and lower secondary schools teaches Muslim students on Islamic ways of social relationship between boys and girls, where it emphasizes on chastity and the part of bodies that should be covered. Higher secondary Muslim students are also taught about religious, teaching on marriage, and they will be reminded to avoid religiously forbidden sexual behaviors such as fornication and homosexuality. Moral education teaches non-Muslim students on several main principles of producing holistic individuals, physically, intellectually, emotionally, spiritually, and socially. These supporting details have showed that it supported the main point. The last main point will be Program Sehat Tanpa AIDS untuk Remaja, which is known as PROSTA, is also one of the available programs which is related to sex education that is designated for students and the public. Program Sehat Tanpa AIDS untuk Remaja (PROSTA) is a health and community-based nationwide program run by the Ministry of Health with the concept of by youth, through youth, and for youth. The program involves young people aged 13 to 25 years who are trained to be peer counselors. Various programs such as campaigns, seminars, workshops, group activities, sports, and many others have been carried out to inculcate knowledge on healthy lifestyle, sexuality education, and prevention of sexually transmitted disease and HIV/AIDS. Modules that were developed by the Ministry of Health known as PROSTA, Youth Training Module Manual, which talks about the prevention of STDs and HIV/AIDS. These supporting details have provided useful information that supported its main point. In the conclusion, although there are many challenges that have prevented proper sex education to be provided in schools, there are still several programs that can be implemented and designed for students and the public. Thank you, that's all from our group.